So let's go first, Christine. What would you tell your patient? What is menopause?
Yeah, I mean, menopause is a moment in time, right? Menopause is when a patient looks at the calendar and says, my goodness, I haven't had my period for a year. It's a split second, right? And I'm very big on verbiage because I think that when we use perimenopause, postmenopause, menopause, people get confused. So to be correct, the period after you've lost your period for a year is called postmenopause, although some people say we should just say menopause because postmenopause implies that there's an end. Regardless, it's the time after. And the time leading up to that is perimenopause, when your hormones are up and down, left, right, and center. And I think we're going to save that big discussion for our next podcast because I have a lot to say about that. That's a bit about the verbiage, right? When people say they're menopausal, I often ask them to clarify, what does that mean? Are you still cycling? That doesn't mean that they're not in perimenopause, but it doesn't mean they're actually in the postmenopausal period. So I think we have to really clinch the verbiage because there's a lot of nonsense out there to begin with. And there's a lot of use of terms that make it even more confusing.